Hello, I'm Chief National Investigative Correspondent Mark Albert. Our National Investigative Unit uncovers cyber vulnerabilities that affect us every day, from healthcare to cell phones, from the military that defends us to the airplanes we fly on, and even in our elections. And we reveal what's being done to patch the gaps and protect us from Cybergeddon. 2019 was the worst year on record for data breaches and exposed records, and no industry suffered more cyber attacks than healthcare. So we investigated the startling cyber weaknesses in hospitals, clinics, and medical device makers. Our Hacking Your Health investigation found many attacks are motivated by greed, curiosity, money, and politics, putting lives at risk. Strapped to a stretcher.
What's going on today?
Surrounded by medics, nurses, and doctors.
Let's start with 2 of Ativan IV.
This man is about to play patient zero in what America's healthcare industry fears could be the next major pandemic, Cybergeddon.
Alert, all computer monitors are down in the hospital system.
This is a heart-pounding, pulse-racing demonstration of what happens when a cyber attack paralyzes or hijacks equipment found in every hospital in the country, and devices like insulin pumps in many homes.
It's going to be one of those can go wrong, will go wrong days.
The crucial question, when hackers take down critical care devices like in this extreme example, can doctors still save the patient?
It's a very visceral, sympathetic, stimulating experience.
We're raising the alarm.
Doctors Christian Demeff and Jeff Tully are hackers turned healers who performed this demonstration in March at a cybersecurity conference in San Francisco.
It had a cybersecurity vulnerability that was exploited.
Can most hospitals detect the moment a cyber attack is underway?
I would say not most, no.
Is that a problem?
It is. We believe too much emphasis is put on the protection of patient data instead of the protection of patient care. We joke around to say we love our patients' privacy, but we'd like them to be alive to use it. A great example of this being WannaCry.
WannaCry was the shock to a healthcare system long predicted. In 2017, the strain of ransomware shut down some hospitals in Britain's National Health Service. The U.S. blamed North Korea.
We didn't learn the lessons of WannaCry here in the United States.
Why do we need to wait for people to be hurt by this? Why can't we prevent that from happening altogether?
If prevention is the best medicine, lots of places didn't get the script. Digital analytics firm NetScout found attacks that paralyzed web networks at hospitals and physicians' offices soared up to 1,400% in a 12-month period. And even though 3/4 of healthcare organizations said in a 2018 survey that they've had a significant security incident in the past 12 months, only 9% of healthcare organizations think a cyber breach in the supply chain is a top potential cyber threat. The Department of Homeland Security thinks otherwise. In research for the National Investigative Unit, DHS numbers show it issued more medical device vulnerability warnings in the 2018 fiscal year than in the previous years combined.
If you're a hacker and you're looking to get the largest payoff you can, you're not going to attack one medical device. You're going to attack the library that's used in hundreds of medical devices.
Daniel Beard at Promenade Software
Right now we're scanning for vulnerabilities in the code.
helped create, with the FDA's blessing, a clearinghouse where medical device manufacturers can now share flaws. Well, that's a lot of red.
That is a lot of red. 30 tests that have failed.
Instead of keeping vulnerabilities secret.
When you sell a device to a hospital, there needs to be a plan in place for how you're going to keep it updated, how you're going to address the new vulnerabilities that come out to it.
But that has not been the business plan, has it, for many years?
For many years it hasn't been, no.
We're clearly 10 to 15 years behind.
Michael McNeil is the top product security officer at Royal Philips, one of the largest medical device manufacturers.
Why are you so candid about the shortcomings in your industry?
I will be candid because by being candid, it allows us to help accelerate and move the industry in the right direction.
McNeil pressed his peers to, in his words, step up in a 2019 FDA workshop where the agency rolled out new cybersecurity benchmarks devices must meet in order to win its approval. Dr. Suzanne Schwartz at the FDA is leading the effort.
Is there any central database anywhere that tracks the cyber assaults against hospitals and healthcare providers and the consequences?
There isn't really any central database.
Wouldn't it be helpful if there was?
It would be. Yes, it would be. I'm not sure where that repository would be.
How about the FDA?
But, I think we've got a lot on our plate right now. It is much more powerful to really be able to identify different groups among the community and have them really take ownership and accountability.
On alerts, then.
Part of that voluntary effort is taking place here at a cybersecurity lab at Massachusetts General Hospital in Cambridge, where the FDA allowed us to see research results never before shown publicly, led by Dr. Julian Goldman.
You have to think about what bad things could happen and then what steps to put in place before they happen to protect the patients.
Goldman's team identified 4 key shortcomings in American healthcare. Data transmitted within a hospital is typically not encrypted. Some support staff are turning off security protections, don't always recognize when malware infects a device, and need to partition networks so a hacker can't see the entire system.
Identify problems and issues.
But some of Dr. Goldman's cybersecurity research has been cut by almost 60% by the Trump administration, which also slashed next year's proposed DHS science and technology budget by $219 million.
This is important research. It's there to improve patient safety and patient care. So it's frustrating to see these cuts.
Frustration and a blunt diagnosis.
If you're connected to the internet, you're vulnerable.
From doctors trying to treat the problem. And we've learned the number of victims of data breaches in the past 2 years currently being investigated is now up to more than 49 million people. The state with the most? Minnesota. One of the doctors we featured in that story got a promotion shortly after our interview. Dr. Christian Demeth at UC San Diego Health was named the first medical director of cybersecurity at any hospital in the U.S. Demeth warns that many medical devices still run on Windows 7, which Microsoft will stop supporting in January. Still ahead on CyberWatch, it's cool, it's fun, and it's free. But you won't be smiling when you hear who's behind this popular app or who owns that smile you snap. Then, a massive breach opens the door to hackers. We'll tell you how they can now track 1 billion people worldwide in real time. Plus, speaking of time, new research finds certain smartwatches can be hacked, allowing spies to listen to you and your kids. And a warning from one of America's cyber leaders. Given your government background, is now the time to be cutting cybersecurity funding?
In my estimation, no, it is not.